Coweta Cares is a crisis response team comprised of a licensed counselor and a paramedic. We respond to all 911 calls that are psychiatric in nature, suicide attempts, suicide threats. We get to then not only assess them, but then serve them, help them the best way that we can. If needed, I can then coordinate admission into our crisis stabilization unit at the care campus. When we arrive on a scene and I can look at a person and say, I'm a counselor, like something about their demeanor changes, it feels safer.
My wife was kind of acting really goofy, for lack of a better term. And so we called 911. They sent paramedics as well as Coweta Cares out to our house. And in doing so, they were able to resolve our situation and get us the resources we need to get my wife the care that she needed. Within a few weeks later, my son was exhibiting the same issues with this encephalopathy, almost to the point that he was expressing suicide thoughts, severe suicide thoughts, and I could not control them, and in which case I called and they showed up and engaged with him and got him the care he needed.
We are the epitome of meeting people where they are at. In a world where mental health can still be somewhat stigmatized or even confusing, sometimes it is hard for people who truly need the help to get the help that they need because maybe they don't want to come into a clinic or they're scared to walk into a crisis stabilization unit. Well, we're showing up, like we are with them in their home. We're with them literally on the side of the road, under a table, anywhere where they are, we are right there in a setting that's more authentic, sincere, I think can convey care in just a very beautiful way.
Coweta Cares has been hugely impactful for the community. It's definitely helped the fire department due to we don't have to have so many people tied up on calls. Before Coweta Cares, we had 3 units that would actually respond. Then the EMS, really their only option was to transport the patient to the hospital.
And so when we're able to say, oh, here, I'm gonna take this client to our crisis stabilization unit because it is mental health related, if we weren't there, that person might have ended up in jail.
So they can get them right in and get them, being evaluated for the help they need.
I am here working at Coweta Cares because I believe strongly about serving people in the community and meeting individuals where they're at. We've interrupted suicide attempts. We've settled down family in one of the most tragic moments of their life. I mean, there's no better way that I know of as a counselor to serve people real time, on the ground. When we come into a home, we are able to provide education to the individual's families, their spouse, their children, and kind of share and give some insight into what this person might be experiencing. We see that when that individual is able to overcome some of those mental health struggles, they're able to better connect back with their family and just continue, with their mental health journey.
Well, quite frankly, if Coweta Cares had not responded in the way they had, I'm not sure that our family would be together the way we are now. I'm not sure that my son would be thriving the way he is. I'm not certain that my wife would have a grasp of her health issues.
You actually see these clients' lives change. You actually hear clients come back and say, you changed my son's life, you saved my mom. I don't really know of a lot of things that's better than that.